We would like you to stay informed of the rapidly changing video conferencing landscape. With the rapid spread of COVID-19 across the United States, nursing homes must adhere to the CDC's guidelines for vulnerable patients, such as limiting visitors and outside consultants. These measures are critical as coronavirus has most seriously impacted older people and people with pre-existing conditions. 8 out of 10 deaths of COVID-19 in the United States have been adults aged 65 or older. In the well-known case of Seattle, the disease ravaged a nursing home, resulting in 25 deaths and infecting 129 residents. Dozens of the facility's employees also tested positive and subsequently spread the disease to their other communities. For this reason, more and more skilled nursing facilities are turning to e-medicine to maintain patients' continuity of care. E-medicine allows patients to continue receiving critical ongoing treatment, including chronic treatment. Precendoth's status as essential medical personnel within skilled nursing facilities ensures that providers are able to continue treating patients at bedside, though when necessary are able to utilize Precendoth's e-medicine platform to continue treatment delivery without an in-person visit. Thanks to Medicare Waiver 1135 and the passage of the CARES Act, more and more facilities are able to take advantage of e-medicine. Many states, along with Washington, D.C., have elected to expand the use of e-medicine to combat the coronavirus outbreak. It is projected that more states will act and that more nursing homes will incorporate e-medicine appointments with specialists to help limit the spread of the virus among the older persons under their care. New medicine rules help more patients access e-medicine. The Centers of Medicare and Medicaid Services recently broadened access to e-medicine services during the COVID-19 pandemic with the 1135 waiver that gives patients more options to see a doctor online rather than travel to a hospital or clinic, thus limiting exposure to the virus. Under the new waiver, Medicare can pay for more e-medicine visits, including from doctors, nurses practitioners, clinical psychologists, and licensed social workers. Physicians are in high demand to treat patients electronically, as many of our patients reside in skilled nursing facilities. Before this waiver, Medicare could only pay for e-medicine on a limited basis, such as when a patient lives in a rural area without access to clinics. The new rules also state that the HHS Office for Civil Rights will waive penalties for HIPAA violations against healthcare providers that provide e-medicine services in good faith to patients through the e-medicine HIPAA platform provided by the Precendoth Group. These new rules allow elderly patients to access their doctors without traveling, which makes them and caregivers safer. Elderly patients at home and in skilled nursing facilities should use e-medicine for most of their medical needs when possible, unless they start experiencing dangerous symptoms of COVID-19, such as extreme shortness of breath and prolonged high fever and other COVID-19 symptoms designated by the CDC. With shelter-in-place orders across the United States and hospitals canceling appointments and elective procedures, there is more need than ever for e-medicine. The demand is skyrocketing, and providers are moving to meet the demand. Precendoth recently announced an expansion of its e-medicine program. While e-medicine is not a substitute for bedside care, Precendoth technology provides a platform for patients, at-home healthcare providers to interface with specialists to improve patient outcomes, while also protecting all parties from COVID-19 infection. Physicians that work with nursing home facilities are a great benefit to the facility, patients and families alike. Working with an organization like Precendoth helps reduce rehospitalizations, improves healing times, and saves tens or even thousands of dollars in healthcare dollars. Physicians work with skilled nursing facilities to develop treatment plans, consult and guide patient treatment, and educate nursing staff. The physician may visit a facility once a week in person or via e-medicine and becomes a trusted and consistent member of the patient's care team. As Precendoth has expanded e-medicine offerings during the COVID-19 crisis, It is a great time for nursing homes to take advantage of e-medicine to treat patients' chronic wounds. During the pandemic that largely affects older people like a novel coronavirus, now is the time for everyone to help slow the growth and flatten the curve. This prevents hospitals from being inundated with coronavirus patients, which then taxes medical supplies and puts healthcare workers at risk. Social distancing and e-medicine are key ways to help patients and healthcare workers stay safe. Patients will get the treatment they need without visiting the clinics or hospitals, limiting exposure. It is important for even more states to enact rules that give patients on Medicare and Medicaid more access to e-medicine, as this is our most vulnerable population. Precendoth is working hard to increase access to e-medicine while providing the utmost care to the elderly in skilled nursing facilities. To learn more about services offered by Precendoth, either at bedside or via e-medicine, visit us here. Precendoth has many products and services, all of which you can find at www.precendoth.com.